81. When assigning tasks to unlicensed assistive personnel, UAP, the nurse should A. Assign tasks based on the UAP's level of education, not their experience. B. Ensure the tasks are within the UAP's scope of practice and competency. C. Always assign the most complex tasks to UAP to save time. D. Delegate tasks only when the nurse has no other responsibilities. Answer. B. Ensure the tasks are within the UAP's scope of practice and competency. Rationale. Delegating tasks to UAP should be based on their competency and scope of practice to ensure patient safety and quality care. 82. What is the nurse's responsibility if a patient refuses a recommended treatment? A. Ignore the refusal and proceed with the treatment. B. Respect the patient's decision and document the refusal. C. Forcibly administer the treatment to prevent harm. D. Involve the patient's family in making the decision. Answer. B. Respect the patient's decision and document the refusal. Rationale. Respecting the patient's autonomy and documenting their decision is key to providing ethical care. 83. When managing the care of a patient in pain, the nurse should A. Assume the patient's pain is not severe and delay medication administration. B. Perform a comprehensive pain assessment and provide appropriate interventions. C. Avoid administering pain medication to prevent addiction. D. Offer non-pharmacological interventions without assessing pain level. Answer. B. Perform a comprehensive pain assessment and provide appropriate interventions. Rationale. A thorough pain assessment helps tailor interventions and ensures that pain is effectively managed. 84. A nurse is caring for a patient who requires a blood transfusion. Which action should the nurse take before administering the transfusion? A. Ensure the blood is compatible with the patient's blood type. B. Administer the transfusion without verifying the patient's identity. C. Administer the transfusion immediately, even if it's not fully prepared. D. Delegate the responsibility of verifying blood compatibility to the UAP. Answer. A. Ensure the blood is compatible with the patient's blood type. Rationale. Ensuring blood compatibility is critical to preventing transfusion reactions. 85. When working with a patient who is non-compliant with treatment, the nurse should A. Force the patient to comply by explaining the risks of non-compliance. B. Understand the reasons for non-compliance and collaborate on finding solutions. C. Ignore the non-compliance and continue with the treatment plan. D. Report the patient to the physician without discussing the issue. Answer. B. Understand the reasons for non-compliance and collaborate on finding solutions. Rationale. Understanding the root cause of non-compliance and working with the patient on solutions is essential for improving adherence. 86. The nurse is caring for a patient with a chronic illness who is experiencing a sudden change in condition. What should the nurse do first? A. Monitor the patient and wait for the condition to improve. B. Reassess the patient's condition and notify the healthcare provider. C. Administer medication as prescribed without reassessing. D. Document the change and inform the patient's family only. Answer. B. Reassess the patient's condition and notify the healthcare provider. Rationale. A thorough reassessment helps identify the severity of the change, and notifying the healthcare provider ensures timely intervention. 87. What is the nurse's role in ensuring informed consent is obtained? A. The nurse is responsible for explaining the procedure and obtaining consent. B. The nurse witnesses the signature and ensures the patient understands the procedure. C. The nurse is not involved in obtaining consent for procedures. D. The nurse ensures that consent forms are signed, but doesn't discuss the procedure. Answer. B. The nurse witnesses the signature and ensures the patient understands the procedure. Rationale. The nurse's role is to ensure that the patient is informed and that the consent process follows legal and ethical guidelines. 88. What should the nurse do if a patient's advance directive is unclear? A. Ignore the directive and proceed with treatment as planned. B. Consult with the patient's family or healthcare provider for clarification. C. Assume the patient would want the most aggressive treatment. D. Follow the last known directive and ignore current circumstances. Answer. B. Consult with the patient's family or healthcare provider for clarification. Rationale. If the advance directive is unclear, it is important to clarify the patient's wishes to ensure care aligns with their preferences. 89. A nurse is supervising a nursing student during a patient care assignment. What should the nurse do if the student makes an error? A. Ignore the error and continue the assignment. B. Correct the error immediately and discuss it with the student to enhance learning. C. Wait until the student finishes the task before discussing the error. D. Report the error to the supervisor without addressing it with the student. Answer. B. Correct the error immediately and discuss it with the student to enhance learning. Rationale. Addressing errors immediately helps prevent further issues and provides an opportunity for learning and improvement. 90. What should a nurse do when a patient expresses a fear of medical procedures? A. Ignore the fear and proceed with the procedure. B. Offer reassurance, provide information, and address the patient's concerns. C. Advise the patient to not worry and proceed quickly. D. Avoid discussing the procedure to prevent further anxiety. Answer. B. Offer reassurance, provide information, and address the patient's concerns. Rationale. Providing information and reassurance helps alleviate fear and supports the patient's emotional well-being. 91. When delegating tasks to unlicensed assistive personnel, UAP, the nurse should consider A. The nurse's workload and delegate tasks based on personal preference. B. The complexity of the task and the UAP's training and experience. C. The patient's family's preferences for care. D. The UAP's personal comfort level with the task. Answer. B. The complexity of the task and the UAP's training and experience. Rationale. Tasks should be delegated based on the UAP's competency and the complexity of the task to ensure safe and effective care. 92. In a disaster situation, the nurse should prioritize care for A. Patients with minor injuries who can wait for treatment. B. Patients who require immediate life-saving interventions. C. Patients who request care but are not critically ill. D. Patients who have been waiting the longest for care. Answer. B. Patients who require immediate life-saving interventions. Rationale. In a disaster situation, triage prioritizes care for patients with life-threatening conditions who can benefit from immediate intervention. 93. What should a nurse do when caring for a patient who is in a state of acute confusion or delirium? A. Restrict the patient's movement to prevent injury. B. Maintain a safe environment, reorient the patient, and address underlying causes. C. Sedate the patient to reduce agitation. D. Ignore the confusion and focus on physical needs only. Answer. B. Maintain a safe environment, reorient the patient, and address underlying causes. Rationale. Delirium and confusion require environmental safety, reorientation, and addressing any potential causes like infection or medication. 94. A nurse is caring for a terminally ill patient who is experiencing difficulty breathing. The most appropriate nursing intervention would be A. Provide oxygen therapy as prescribed. B. Perform deep suctioning to clear the airway. C. Place the patient in a supine position for better lung expansion. D. Administer high-dose sedatives to alleviate discomfort. Answer. A. Provide oxygen therapy as prescribed. Rationale. Oxygen therapy is commonly used to manage dyspnea in terminally ill patients, improving comfort and oxygenation. 95. The nurse is preparing to discharge a patient who is newly diagnosed with diabetes. What is the priority action? A. Provide written educational materials about the disease. B. Ensure that the patient understands how to manage their blood sugar levels. C. Instruct the patient to return for follow-up in 1 month. D. Advise the patient to avoid exercise until their condition improves. Answer. B. Ensure that the patient understands how to manage their blood sugar levels. Rationale. Teaching the patient how to manage their blood sugar is crucial to their ability to live safely and independently with diabetes. 96. A nurse is caring for a patient who is being discharged after a stroke. Which action should the nurse take before discharge? A. Give the patient a list of instructions and send them home. B. Ensure the patient understands the discharge instructions and arrange for appropriate follow-up. C. Provide medications without discussing side effects. D. Wait for the patient to ask about care instructions before offering information. Answer. B. Ensure the patient understands the discharge instructions and arrange for appropriate follow-up. Rationale. Ensuring that the patient understands discharge instructions and has follow-up care arranged helps to prevent complications and readmissions. 97. How can a nurse promote patient safety when administering medications? A. Administer medications without questioning orders. B. Use the 5 rights of medication administration and verify with the patient. C. Delegate medication administration to unlicensed assistive personnel. D. Ignore discrepancies between medication orders and the patient's records. Answer. B. Use the 5 rights of medication administration and verify with the patient. Rationale. The 5 rights, right patient, right medication, right dose, right route, right time, should always be followed to prevent medication errors. 98. What should the nurse do if a patient has a complaint about their care? A. Ignore the complaint to avoid confrontation. B. Listen to the patient, acknowledge their concerns, and report the issue to the appropriate person. C. Immediately report the complaint to the physician without further discussion. D. Tell the patient that their complaint is unreasonable. Answer. B. Listen to the patient, acknowledge their concerns, and report the issue to the appropriate person. Rationale. Addressing patient concerns respectfully and reporting issues ensures that the patient's voice is heard and the quality of care is maintained. 99. When planning care for a patient with a complex condition, the nurse should A. Develop a care plan without consulting the healthcare team. B. Collaborate with the healthcare team to create a comprehensive and individualized care plan. C. Only involve the physician in the planning process. D. Delegate care planning to other team members. Answer. B. Collaborate with the healthcare team to create a comprehensive and individualized care plan. Rationale. Collaborative care planning ensures that all aspects of the patient's condition are addressed by a team of professionals. 100. What is the nurse's role when a patient is admitted for a procedure that involves a significant risk? A. Administer medications to ease the patient's anxiety without further explanation. B. Explain the procedure to the patient and ensure informed consent is obtained. C. Assure the patient that the procedure will be risk-free. D. Ignore patient questions to avoid increasing anxiety. Answer. B. Explain the procedure to the patient and ensure informed consent is obtained. Rationale. Informed consent is essential for ensuring that the patient understands the procedure and the associated risks. 101. When delegating tasks to unlicensed assistive personnel, UAP, the nurse must A. Delegate tasks based on the patient's preferences. B. Consider the UAP's training and scope of practice. C. Assign only physical tasks to UAP. D. Delegate all tasks that the nurse does not want to do. Answer. B. Consider the UAP's training and scope of practice. Rationale. Delegation should be based on the UAP's skills and competencies, ensuring that tasks are within their scope of practice. 102. The nurse is assessing a postoperative patient for signs of infection. Which of the following findings would most likely indicate an infection? A. Clear, non-odorous drainage. B. Warm, reddened incision site with slight swelling. C. Decreased white blood cell count. D. Increased heart rate and fever. Answer. D. Increased heart rate and fever. Rationale. Fever and increased heart rate are common signs of infection postoperatively. 103. What is the priority action when a patient is in anaphylactic shock? A. Administer oxygen therapy. B. Initiate an intravenous line and administer fluids. C. Administer epinephrine as ordered. D. Obtain a complete set of vital signs. Answer. C. Administer epinephrine as ordered. Rationale. Epinephrine is the first-line treatment for anaphylactic shock, as it can reverse the severe allergic reaction. 104. When caring for a patient with a central venous catheter, CVC, the nurse should A. Routinely flush the CVC with saline to prevent clots. B. Use a single-use dressing and change it daily. C. Ensure that the catheter is always visible to monitor for infection. D. Remove the catheter as soon as the patient no longer needs it. Answer: A. Routinely flush the CVC with saline to prevent clots. Rationale: regular flushing prevents clot formation and ensures patency of the central venous catheter. 105. A nurse is caring for a patient who has just received a diagnosis of a terminal illness. Which of the following actions is most appropriate? A. Focus solely on pain management and avoid discussing the diagnosis. B. Encourage the patient to immediately begin making end-of-life decisions. C. Provide emotional support, listen to the patient's concerns, and offer resources. D. Disregard the patient's emotional needs and focus on physical care. Answer: C. Provide emotional support, listen to the patient's concerns, and offer resources. Rationale: providing emotional support and resources helps the patient cope with the diagnosis and plan for future care. 106. When delegating a task to a nursing assistant, the nurse should: A. Assume the nursing assistant knows the task completely. B. Provide clear instructions and ensure the nursing assistant understands the task. C. Let the nursing assistant decide the best way to complete the task. D. Delegate tasks only when the nurse is unavailable to complete them. Answer: B. Provide clear instructions and ensure the nursing assistant understands the task. Rationale: clear communication ensures that tasks are performed correctly and safely. 107. What is the nurse's role when a patient is admitted for a surgical procedure? A. Explain the risks of the procedure and obtain informed consent. B. Handle all financial aspects of the procedure. C. Administer all preoperative medications without explaining them. D. Complete the surgical checklist without consulting the physician. Answer: A. Explain the risks of the procedure and obtain informed consent. Rationale: the nurse's role includes ensuring that the patient understands the procedure and obtaining informed consent, but not explaining the risks in detail. This is the physician's responsibility. 108. What is the most important consideration when discharging a patient with a new diagnosis of hypertension? A. Provide the patient with a list of antihypertensive medications. B. Discuss the importance of lifestyle modifications and medication adherence. C. Provide the patient with written materials only. D. Ensure the patient has a follow-up appointment within 1 year. Answer: B. Discuss the importance of lifestyle modifications and medication adherence. Rationale: educating the patient about managing hypertension through lifestyle changes and medication adherence is critical for long-term health management. 109. Which of the following is the nurse's primary responsibility when caring for a patient in isolation precautions? A. Ensure that the patient has access to television and entertainment. B. Monitor the patient's vital signs and laboratory results. C. Prevent the transmission of infection to others by following proper infection control procedures. D. Avoid providing care to the patient to minimize the risk of infection. Answer: C. Prevent the transmission of infection to others by following proper infection control procedures. Rationale: the primary responsibility is preventing the spread of infection through adherence to infection control protocols. 110. The nurse is caring for a patient who has just been diagnosed with a chronic illness. Which of the following is the most appropriate nursing intervention? A. Immediately begin the patient on a strict medication regimen. B. Provide emotional support and educate the patient on managing the illness. C. Limit the patient's participation in self-care activities to avoid stress. D. Focus primarily on the patient's physical symptoms and ignore emotional needs. Answer: B. Provide emotional support and educate the patient on managing the illness. Rationale: providing education and emotional support helps the patient manage their illness more effectively and reduces anxiety. 111. A nurse is caring for a patient with a nasogastric NG tube. What is the priority action before administering medications through the NG tube? A. Flush the NG tube with water to ensure patency. B. Check the placement of the NG tube. C. Mix the medications with a large volume of water. D. Administer the medications without checking the tube. Answer. B. Check the placement of the NG tube. Rationale. Ensuring correct placement of the NG tube is essential before administering medications to prevent aspiration or incorrect delivery. 112. A patient who has a history of diabetes and hypertension is being discharged. The nurse's teaching plan should emphasize A. How to administer insulin injections properly. B. The importance of adhering to medication and dietary recommendations. C. The need to avoid physical activity to manage blood pressure. D. How to monitor blood glucose levels at least once a week. Answer. B. The importance of adhering to medication and dietary recommendations. Rationale. Adherence to medication regimens and dietary changes is essential to control both diabetes and hypertension. 113. The nurse is preparing to administer a medication that could cause an allergic reaction. What should the nurse do first? A. Administer the medication and observe for any reactions. B. Ask the patient if they have any allergies and confirm the allergy history. C. Give the patient an antihistamine before administering the medication. D. Wait for the patient to show signs of an allergic reaction. Answer. B. Ask the patient if they have any allergies and confirm the allergy history. Rationale. Verifying allergies before administering any medication is crucial to prevent adverse reactions. 114. The nurse is caring for a patient who is experiencing chest pain. What is the nurse's first priority? A. Administer pain medication as prescribed. B. Assess the patient's vital signs and oxygen saturation. C. Monitor the electrocardiogram (ECG) for abnormalities. D. Notify the healthcare provider immediately. Answer. B. Assess the patient's vital signs and oxygen saturation. Rationale. The first priority is to assess the patient's vital signs and oxygen saturation to determine the severity of the chest pain and guide further interventions. 115. What is the nurse's primary role in patient education? A. Provide written materials only. B. Teach the patient and family about the condition and treatment plan. C. Encourage the patient to ask questions after discharge. D. Assume the patient understands the information provided. Answer. B. Teach the patient and family about the condition and treatment plan. Rationale. The nurse's role is to ensure the patient and family understand the condition, treatment options, and any necessary lifestyle modifications. 116. A nurse is caring for a patient receiving chemotherapy. What is the most important nursing intervention to prevent infection? A. Administer prescribed antibiotics. B. Monitor for signs and symptoms of infection. C. Maintain strict hand hygiene and provide patient education on infection prevention. D. Place the patient in isolation immediately. Answer. C. Maintain strict hand hygiene and provide patient education on infection prevention. Rationale. Preventing infection through hygiene practices and education is a priority for patients undergoing chemotherapy, as their immune system is compromised. 117. A nurse is preparing a patient for a scheduled surgery. Which of the following actions is most important in preventing postoperative complications? A. Ensure the patient is well hydrated and rested before surgery. B. Inform the patient about the expected recovery time. C. Explain the surgical procedure and risks thoroughly. D. Complete preoperative laboratory tests and imaging. Answer. A. Ensure the patient is well hydrated and rested before surgery. Rationale. Adequate hydration and rest help the patient recover more effectively and reduce the risk of complications during and after surgery. 118. The nurse is caring for a patient with a history of substance abuse who is recovering from surgery. What is the most important action for the nurse to take? A. Provide pain management without considering the patient's history. B. Monitor the patient closely for signs of withdrawal or dependence. C. Administer pain medication only when the patient requests it. D. Assume the patient will experience withdrawal symptoms and prepare accordingly. Answer. B. Monitor the patient closely for signs of withdrawal or dependence. Rationale. Monitoring for withdrawal or substance dependence ensures appropriate care and prevents complications related to substance use history. 119. A nurse is caring for a patient with a newly inserted indwelling urinary catheter. The nurse should A. Empty the catheter bag at least once every shift. B. Change the catheter every 72 hours. C. Ensure the catheter is securely taped to prevent accidental removal. D. Flush the catheter with sterile saline at the end of each shift. Answer: C. Ensure the catheter is securely taped to prevent accidental removal. Rationale: securing the catheter prevents accidental dislodgement, reducing the risk of trauma and infection. 120. When managing care for a patient with a history of falls, the nurse should A. Place the patient in a high bed to prevent falls. B. Ensure that the patient's call bell is within reach and provide frequent checks. C. Limit the patient's mobility to reduce the risk of falls. D. Restrict the patient from getting out of bed without assistance. Answer: B. Ensure that the patient's call bell is within reach and provide frequent checks. Rationale: regular monitoring and ensuring the call bell is within reach can help prevent falls by enabling the patient to call for assistance.